Creating a healthier nation, county by county. For the next few minutes, we'll discuss the Healthy County Initiative. Hello, everyone, and welcome to Comcast Newsmakers. I'm Robert Tranum, and we are here on location in our nation's capital for the National Association of Counties Legislative Conference. Joining me is Commissioner Lenny Eliason, immediate past president of NACo. Welcome to the program.
Thank you for having me.
So we hear over and over and over again from the First Lady, from people like yourself, that we must eat healthier in order to preserve our life. Does it really work?
It absolutely does. When you realize we spend about 80% of our healthcare dollar on the treatment of chronic and preventable diseases, and when you do the research and you look at the studies, you find out that it's all related to diet. What you eat, and you've heard this before, garbage in, garbage out. The healthier you eat, the better off you are.
So there is a direct correlation between your diet and perhaps diabetes, obesity, and so forth, heart disease?
When you look at them all, they're all related. One of the biggest connectors of them all is cholesterol. We talk about cholesterol in this country and realize we have to keep it in healthy levels and we should reduce it. One of the interesting examples is we say it's okay to have a cholesterol of about 150 milligrams. When you look at China, they have 100.
Interesting.
The traditional Western diet is killing us. When you look at our expenditures on healthcare, we expend the most money in the world on healthcare, yet we have the fifth best outcomes.
So this is a financial dilemma that we find ourselves in, also a health. I mean, there's no question about it. But I would assume that the more unhealthy we are, the more expensive it becomes in the long term in terms of treatment and so forth. And the majority of this, are you saying, is preventative? Or a good portion of it is?
Absolutely. The majority is preventative. When you look at the research, you find out that what you eat relates to what happens in your blood. Remember the cholesterol and growing those problems. If you eliminate cholesterol and reduce your cholesterol, you're in a huge step to becoming healthy. You're also in a huge step to losing weight, lowering your blood pressure. They're all interrelated. Our body is a complete network, and the idea is to make sure you keep the network in balance.
And what does this mean at the county level? Why does this affect you?
Well, one of the things that's important for people to understand is we spend about $68 billion a year on health care through the fact we operate hospitals. We're the payers of last resort in a lot of cases. We treat the medically indigent. We treat all the people out there through Medicaid. And so we're the ones that provide a lot of these services throughout the country. We're probably the largest public provider of any type of service as far as it relates to healthcare because of the networks we operate with clinics and hospitals.
So we know we're supposed to eat healthy. We know that most people know that when you put in, your body has a direct correlation with your health. So why do we continue to eat unhealthy and have unhealthy habits?
It's what we're used to eating. It's also cheaper. When you start thinking about eating healthy, we don't have the availability for a lot of people. There are food deserts throughout this country.
You hit the nail right on the head in terms of it's cheaper. So how do we fix that problem?
We have to realize that it's actually cheaper to eat fresh fruits and vegetables. Think about eating a pound of potatoes and how many bags of potato chips it makes to get a pound of potatoes. You can get food out there. You have to look at the choices and what you do. And we hear more about people are so busy they can't prepare food, they eat fast food. We don't need to do that. You plan and prepare and you can eat healthy and you can do it in a proper manner.
We have about 40 seconds left. Very quickly, what do you say to the person out there that says, there is no fresh market near my house. It's very, very expensive for me to purchase fresh produce. I simply cannot afford it when I can literally go down to the fast food store and it's only $2 for a whole entire meal.
That's one of the biggest problems we have, to go out and look at the farmers markets. Pressure your leaders to go out and start to create farmers markets. That's one of the biggest expansions we have. Also, you have counties out there that are giving credits for people to bring in supermarkets and surviving in this country. And we have counties that are opening their fourth and fifth supermarket in those food deserts.
All right. Well, thank you very much for joining us. We really appreciate it.
Thank you for having me.
And keep up the good work.
Thanks.
And, of course, thank you for joining us for this edition of Comcast Newsmakers. I'm Robert Tranum. Have a great day, everybody. We'll see you next time. Take care and try to eat healthy.